Today's drug is Atenolol, brand name Tenormin. The pharmacologic and therapeutic class is an antihypertensive, an anti-anginal agent, or a beta-1 selective beta blocker. Dosage form and strength. The medication comes as a tablet in a 25 mg, 50 mg, and 100 mg strength. Indications and dosing for adults. The first indication is for hypertension. The treatment range is between 25 and 100 mg taken by mouth every day. When initiating, start between 25 and 50 mg by mouth every day with dose increases every 1 to 2 weeks, up to a max of 100 mg per day. If discontinuing, gradually taper the patient off the medication. The next indication is for angina. The treatment range is between 50 and 200 mg taken by mouth every day. When initiating, start at 50 mg by mouth every day with dose increases every week with a max of 200 mg per day. The next indication is for Post-MI Cardiovascular Event Prevention. The treatment dose is 100 mg per day by mouth divided 1 to 2 times daily. The initiation is as soon as possible after the patient is stable. An off-label indication is for migraine headache prophylaxis. The treatment range is between 50 and 150 mg by mouth every day. When initiating, start between 25 and 50 mg by mouth every day up to a max of 150 mg per day. Indications and dosing for pediatrics. All the indications currently are off-label uses in pediatrics. The first off-label indication is for hypertension. The treatment range is between 1 and 2 mg per kilogram per dose taken by mouth every day. When initiating, start between 0.8 and 1 mg per kilogram per dose by mouth every day up to a max of 2 mg per kilogram per day. The next off-label indication for pediatrics is in supraventricular arrhythmias. Currently, there is no optimal dose established, with the treatment range being somewhere between 0.3 and 2 mg per kilogram per dose taken by mouth every day. The max dose is 2 mg per kilogram per day. The final off-label indication in pediatrics is for Marfan syndrome-associated aortic dilation. For ages 6 months and older, the treatment range is between 1 and 4 mg per kilogram per dose taken by mouth every day. When initiating, start at 0.5 mg per kilogram per dose taken by mouth every day up to a max of 250 mg per day. Mechanism of action and pharmacology. Atenolol is a competitive beta-1 selective beta blocker with minimal to no effects on the beta-2 receptor unless taken at higher doses. The absorption is rapid but incomplete at around 50%. Atenolol does not cross the blood-brain barrier. There is limited hepatic metabolism. Around 50% is excreted in the feces, with 40% in the urine as the unchanged drug. The onset of action, if taken orally, is about an hour or less, with the peak effect occurring around 2 to 4 hours. The duration of action is between 12 and 24 hours, with the antihypertensive effects at around 24 hours. The half-life elimination in newborns less than 24 hours of age is around 16 to 35 hours. In children and adolescents, it is around 3.5 and 7 hours. And in adults, the half-life elimination is between 6 and 7 hours. Atenolol is between 6 and 16% protein bound. Special populations and considerations. For the renally impaired, the clearance is related to GFR, and the concern is when creatinine clearance falls below 35. In elderly, clearance is around 50% lower, and half-life elimination is longer. Patient contraindications and cautions such as sinus bradycardia, heart failure, cardiogenic shock, and use caution if major surgery, diabetes mellitus, thyroid disorders, second or third trimester pregnancy, or if the creatinine clearance is less than 35. In regards to pregnancy, The medication does cross the placenta, and it is found in cord blood. It may cause harm to the fetus, and it is associated with adverse effects. Side effects. Some common side effects are bradycardia, leg pain, drowsiness, vertigo, nausea and vomiting, hypotension, fatigue, and cold extremities. Some serious side effects are CHF, heart block, ventricular arrhythmia, bronchospasm, SLE, and MI if the drug is abruptly stopped. There is a black box warning to avoid abrupt cessation of the medication. Patients with CAD may experience angina exacerbation, MI, and/or ventricular arrhythmias with an abrupt cessation of atenolol. If discontinuing, taper off gradually and monitor the patient. If angina worsens or issues develop, restart the treatment. Drug interactions. Some considerations for drug interactions is that the medication is an OAT P2B2 substrate. It is an antihypertensive agent. Concerns with bradycardia, as well as delays in atrioventricular conduction. Some contraindicated drugs and drugs of note are albuterol, clonidine, timolol, piroxicam, dexamethasone, prednisone, and trazodone. Monitoring parameters. Creatinine, blood pressure, heart rate, ECG, as well as a 10-year ASCVD risk. Patient counseling information. Atenolol is used in the treatment of hypertension, stable angina, and used to lower the chance of death after heart attack and MI. The medication can be taken with or without food, and usually it's taken 1 to 2 times daily. Avoid apple juice and orange juice, which can prevent atenolol from being absorbed. It may take somewhere between 1 to 2 weeks before experiencing the full benefits from atenolol.